We're super excited that you're having surgery at New Life Cosmetic Surgery. And if any of your procedures are gonna have a scar, there's some really important things that you can be doing to help. And you'll hear some of these things multiple times on other videos that we might have given you, but the main things is from a nutrition standpoint are these. One, making sure that your blood sugars are under very, very good control. So if you do have diabetes, you absolutely need to have that under extremely good control. But even if you don't have diabetes, avoid a lot of the sugar intake. Don't be drinking drinks that have a lot of sugar, or actually even juices have a lot of sugar. So a glass of orange juice isn't the best thing to do. We want to limit the sugar because sugar causes inflammation. So avoid sugar for 6 weeks. Really eating a lot of protein, at least 100 grams of protein is absolutely vital. And so sometimes you're not able to eat a lot of protein just because of work and different things like that. So you need to then drink it, right? Whether it's you're making your own protein shakes or you're buying just pre-made protein shakes at the grocery store, it's very, very important to doing 100 grams a day. As far as like vitamins and things like that, vitamin C, I love 1,000 milligrams twice a day, and zinc, 50 milligrams a day, really both help with the skin. Those oftentimes don't take on an empty stomach because it can make you feel a little nauseated afterwards. Collagen, peptides, again, it's not gonna hurt. How much is it gonna help? Not quite sure as far as what the studies show, but taking some collagen peptides, you can get those just a scoop over the counter and scoop that into your protein shake. That's not gonna hurt, and it definitely could possibly help as well. Other things is staying super hydrated. Drinking tons of water, not getting dehydrated is important. Hydrating your skin. No matter what procedure you're having done, oftentimes when we remove skin, the skin gets tight and then the skin can get dry. So making sure you're keeping your skin nice and hydrated with either Eucerin or CeraVe skin moisturizer, and doing that, keeping it hydrated for the first 6 to 8 weeks is important as well. We'll talk to you about silicone scar tape and gel and whether or not that's something important depending on what type of surgery you have, but we'll mention that specific for your surgery. And then lastly, just avoiding smoking or even secondhand smoke. If you live with a person that smokes, really try to stay away from that, and obviously yourself, stay away from smoking. And smoking, what I mean by that, I mean nicotine. So even if you're don't smoke but you vape, you have to stay away from nicotine. Nicotine decreases blood flow to the incision healing, and it can really lead to some problems afterwards. So you need to avoid all nicotine for the first 6 weeks.